Hello, my name is Callum Quinn, second year student ACPE. I will be presenting an argument on the topic of whether drugs should be legalized in sport as a topical issue of contention in the sporting industry and professional athlete environment. I will also discuss the different types of ethics in relation to performance-enhancing drugs in sport. Whether drugs should be legalized is a heavily debated topic. Should performance-enhancing drugs be legalized in sport? Should everyone be able to use them? Would sport be better with performance-enhancing drugs? Why do athletes use drugs? There are many forms of performance-enhancing drugs. The most common and general are diuretics, testosterone boosters, anabolic steroids, HGH, beta blockers, stimulants, narcotics, blood transfusion, and blood doping. These drugs in general increase an individual's overall performance by increasing strength, speed, size, weight, and mental focus. Should everyone be able to use drugs in sport? The most infamous case of illegal drugs in sport was Ben Johnson being stripped of his gold medal. He was a Canadian 100-meter sprinter who competed in the 1988 Seoul Olympics and post-race tested positive for the anabolic steroid stanozolol, banned by the World Anti-Doping Agency, also known as WADA. This was an unfair advantage that Ben Johnson had against the other athletes, giving him a greater level of strength and explosive speed. If everyone were to use drugs in sport, there would be a massive disadvantage because of the different types of drugs out there and the different effects they would have on the individual athletes. Although some people are already advantaged because of genetics and economy, would allowing everyone to be able to use drugs in sport change anything? Here are several well-known cases of drug use in sport, both individual athletes and sporting teams. Lance Armstrong, for example, is a cyclist. He has won 7 Tour de France races. He was found guilty of using erythropoietin and human growth hormone. He not only had blood doping, but also had falsifying documents saying he had passed the drug test, thus suggesting a wider spread of systemic involvement in his drug use. How are drugs in sport prevented from being used? What are the consequences? There are a number of agencies that provide strong enforcement in prevention of drug use in sport. In Australia, these include WADA, the World Anti-Doping Agency, ASADA, Australian Sports Anti-Doping Agency. These agencies randomly test the athletes in different ways to find a positive or negative test. The consequences for cheating vary from fines to bans from the sport to jail time, as they are taken very seriously. There are different ways to test for drug use, such as urine tests, breath tests, hair follicle tests, blood, sweat, saliva, etc. Why do people use performance-enhancing drugs? Most athletes use performance-enhancing drugs to gain an advantage over other athletes, to win and push themselves beyond their natural capabilities. Some individuals have their own reasoning for using illegal drugs in sport, such as personal wealth, a gold medal, fame, increased performance, reduce stress, build mass, etc. What are the health risks of performance-enhancing drugs? Performance-enhancing drugs have been shown to have detrimental impact on individuals' health, and aside from the ethical reasons for banning drugs in sport, this is a key reason that they are banned. There are many different types of drugs which have several side effects, although most are similar. The side effects can be physiological, psychological, and gender-specific. The general health risks of drugs in sport can cause early onset of disease and/or illness, as well as a shortened lifespan. Do performance-enhancing drugs in sport persuade others to also use them in competition or to follow role models in doing so? Yes, performance-enhancing drugs persuade others to also use them in competition. Athletes do not want others having a greater advantage over them. All professional athletes in sport want to be the best, and therefore encourage others to also use drugs to gain an advantage. From this, it also encourages younger teenagers and followers to do the same, to be their idols and succeed in sport. Is there an unfair advantage if athletes do use performance-enhancing drugs? What about the spirit of the sport? Athletes in every sport work hard to enhance their athletic ability and performance, so what is wrong with taking drugs in sport for an extra edge? Athletes are also already naturally gifted due to genetics. A well-known example of this is Eero Mäntyranta, one of the most successful Finnish skiers. He won 7 medals at 3 Olympics. He had an advantage because of his genetic mutation of having extra red blood cells. Yes, there is an unfair advantage if athletes use performing-enhanced drugs, although it is also an unfair advantage that some have genetic attributes that others do not. The spirit of the sport is ruined with users of performance-enhancing drugs having an advantage over others. If everyone else would be able to use drugs, then there would be improved results, bigger, faster, and stronger athletes, making sport more entertaining and competitive. What are the ethical differences when comparing an athlete using performance-enhancing drugs and an athlete using performance-enhancing technologies, such as nutrition, equipment, training, etc.? Third world countries are at a disadvantage compared to first world countries, such as Australia. To have the same diet as a third world country would not be ethically moral, but to ban all drugs from sport can make it a more even playing field for everyone. Not all athletes have access to performance-enhancing technologies such as nutrition, equipment, and knowledge of training, with experienced coaches and facilities. Improved performance predominantly comes from the economy and welfare of the athlete, involving coaches, psychologists, dietitians, massage therapists, training at high altitude, skin-tight swimsuits. Not all athletes have accessibility to these things, putting individuals at an advantage. There are several theories of ethics studied. In regards to ethics and drugs in sport, the following are most applicable. Kantianism is very relatable to drugs in sport. All athletes want to win, regardless of the rightfulness or wrongfulness of the ethical side of drugs in sport, also not caring for the consequences. Virtue ethics emphasizes an individual's character rather than the rules or consequences. This weighs heavily on the individual, whether or not to use the drugs in sport for an advantage. Utilitarianism is the action that will benefit the majority. Athletes may need money for their family or close ones, or want to win a medal for their country. In doing so, cheating by drug taking and competing against the other athletes. Social contract is the view that persons' moral or political obligations are dependent upon a contract or agreement among them to form the society in which they live. Most athletes and all professional athletes sign contracts that agree to following the rules and regulations of the sport. This includes no cheating and no drug use. Ethical egoism is the normative ethical position that moral agents ought to do what is in their own self-interest. This theory of ethics is the most vital. All athletes want the best performance for themselves and to be the best. By improving themselves at their own self-interest, they use drugs in sport. Non-Western alternatives such as Confucianism is an ethical teaching formulated by Confucius and introduced into Chinese religion. Emphasis devotion to parents, family, and friends, cultivation of the mind, self-control, and just social activity. An individual in sport of non-Western alternative may have different reasoning as why they use drugs in sport.